Okay, for some reason my computer won't let me log on. This is not normal. Oh, there we go, odd. Never mind. Right. So we've got, so it should be 15 this morning, and then should be 13 this afternoon, and then probably have a visit or two at lunchtime, and we'll have as many phone calls as there are. So usually what we do is have a quick look at her notes, or whoever's notes, before they come in. If I know them, sometimes I'll just have a quick glance at the last consultation. If I don't know them, I usually have a quick look, past medical problems, medication they're on, what they were last here for, whether they've got anything else outstanding. So I just need to check her results before she comes in. So first appointment is 9:10. It's now 12 minutes past 9. Karen Days, room 7, please. Karen Days, room 7. Hello. Hi Karen, come in. So, how are you doing?
Yeah, not too bad. Still got this cough.
Okay.
I had my chest x-ray and that was clear apparently.
There's a GP crisis. So some places, you can't recruit more GPs, so we can't just say, right, well, we'll all see 10 in the morning and we'll see 20 patients a day, but we'll have longer with them, because what about all those other patients? Someone needs to see them. The average GP consults at 12.5 minutes, I think, is about, and I'm probably slightly longer than that. Nowadays, and rightly so, people expect a dialogue, whereas in the old days it was much more paternalistic. And then these are some of the last ones. With regards to her journey, what she's had, she had very quickly had a chest x-ray when she needed it. She went straight away. She got an ultrasound very quickly. She's seeing a consultant very quickly. I mean, she's got amazing service from the NHS, I think she'd agree, really. So the setup, her pathway she's been on, I mean, that's all purely NHS. There's been no private providers in that pathway she's been on at the moment. I'm not doing great, actually. So it should be a 10-minute consultation, obviously. That lady was in with me for 19 minutes. So I'm already running 9 minutes over. But as you can probably see, I'm not quite sure how I could have had that discussion with her any quicker. So I had to cover two really quite important topics. So okay. So, yeah, so I'm 15 minutes late and it's the second patient. Hello, come in. Hi, Catherine. Come in. How are you, all right?
Yeah, good, thanks.
Good. Had an implant before?
Yes.
And you got on okay with it?
Yeah, I got on fine.
Okay, and you've had a period?
Yeah.
Yeah, but no chance you could be pregnant now?
No.
We talked about that on the phone, didn't we? Choose and book is a patient gets a letter with a reference number, and they can either go online or telephone, and then given options of different hospitals they can go to. Generally it'll be the 2 Bristol hospitals. You might get a choice of a Bath hospital, or you might get a choice of a private hospital. So you go as an NHS patient and get seen at a private hospital. So it's trying to reduce waiting lists by outsourcing to the private sector. Whereas if you funded the NHS or the hospitals correctly and gave them the capacity, they should see all the patients on the NHS, and then the money can stay within the NHS. Okay, so tiny little needle coming now. Okay, I'm just going to feel some stinging coming now. Can you feel that? You okay? You might feel the needle a little bit more now. I'm now running 25 minutes late. Okay, so I've got 5 phone calls to do, which is pretty good actually. Often it can be more. I haven't looked at any blood results yet, and I've got 69 waiting. I've got 8 task messages, which is usually something from reception or the district nurses, health visitors wanting me to do something. I haven't looked at my internal emails. I haven't looked at my Outlook emails. I haven't looked at my Docman, which has got all my documents in it. But a lot of that will probably have to wait till the end of the day, because once I've done my telephone calls and I do my visits, we'll be straight back into afternoon surgery. Hi, it's Dr. Greg at the surgery here. Hi there, did you need to speak to me? Okay. Right, okay. That's all right, no worries, you carry on. Bye, bye, bye. She's one of my favourites. Just do a home visit. So it's lunchtime. Bad day would be 3, really bad day would be 4. Often the people at home, by the nature of it, much more unwell and more complicated, so they take longer. Well, it's 2:30. I've got surgery starts at 3. I haven't actually had any lunch yet and I need to phone because a patient who I've just seen has been discharged from hospital. Is not really safe to be on his own. The NHS hospitals are left holding all the very complicated, all the very expensive patients, and the budgets at the moment don't seem to be following and reflecting that. So in some ways it feels, yes, the private sector's taking the pressure off the NHS, but they cherry pick. They don't have a A&E department in their hospitals, they don't see acute admissions, they don't have an ITU, they don't have patients with multiple comorbidities who are very frail and likely to get very sick. So the cases they're doing are generally otherwise healthy people who have a simple, generally a simple thing that needs doing, and it's much more ticked box, conveyor belt kind of medicine. So I had 14 patients this morning. I've done 5 phone calls. I've done a home visit, which turned out to be more complicated. And I've now got 12 patients this afternoon and some more phone calls. I haven't had lunch, but I have had 3 biscuits and a coffee, so that's quite normal unless it's a bit quiet. Stephen O'Connor, room 7 please. Stephen O'Connor, room 7. I know Stephen well. How are you doing?
The tablets have sort of knocked me out.
Have they?
I'm like walking around on the moon. I spend most of my time in the bedroom now.
Sorry, bear with me a minute. Do you mind if I just take this quickly?
Not at all.
The frustrating part of the job is the slow cog-wheeling turn of the NHS. If someone needs help and you know what they need, but you sometimes can't quite get it for them, or you're doing a second best job because what they really need is not quite available, or it's not available at that moment in time. If she really wants, I'll ask her to come in. Oh no, my other phone's going. Right, okay, thanks Becky. Okay, cheers, thanks a lot, bye. Sorry. The number of GPs is plateaued probably, if not now it's slightly on the decline. So the investment in primary care hasn't gone up with what they're asking us to do. So they're cutting hospital beds, saying, oh, well, you can do that in the community, but the community is not being adequately funded to do that. Thanks, Ruth. Cheers, bye. Right. You have my full attention.
Basically, it's like the tablets you give me.
Yeah.
They're working, like the...
It's rare that someone just comes in with one problem and you can't say, whoa, 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 I only talking about your diabetes today, I can't do your chest infection. You have to, and it's also, you're treating them as a person, so you can't take an individual thing. So you're treating all those things, so they often interplay with each other anyway.
There is one question.
Yeah.
My skin's so dry with all the antibiotics and that.
Oh,
is there any
right.
chance of some oleum?
The problem is every time you get in the bath, you come out drier than you went in. The full time I would consider to be 4 days a week because it's just too tiring and you get emotional fatigue as well as getting physically exhausted. Okay, that's fine. Okay. Okay. Any problems memory-wise at the moment? Any? No?
No.
It's been fairly typical. So I got here at 9 o'clock this morning. and it's now 6 o'clock in the evening, and I'll probably be here for another 3 hours, so a good 12-hour day, which is fairly normal. I've seen 27 patients. I've done 10 telephone calls with patients, and I've done a home visit. I've had 3 rich tea biscuits all day. I've had 1 cup of coffee, and I still have got to read my emails, which I still haven't done, and do my blood results and look at my patient notes. And before I do all that, I need to go and sign the prescriptions that are in reception, so I'm going to go and do that next. Yeah, by 9 o'clock my brain's usually done, so I then have to call it a day. Okay.